Okay, I do have a couple questions before I get the shot.
Of course.
So first of all, I don't quite understand. Once I get my shot today, am I inoculated or only after the second dose?
Your immunization today will provide you some coverage, but the trials have shown that the 94.1% effectiveness of the vaccine is after the second dose.
Okay.
So that's why both doses are highly important.
Okay.
And it's about 2 weeks after the second shot that you're considered fully immune, and that's pretty much standard for any vaccine.
Okay. My other question would be, I guess, I read a lot about the vaccine, but let's say that today I'm one of the people who gets like a low fever or body aches. Does that make me contagious to some people, or am I gonna have COVID in me and I'm gonna be giving it away, or if I get symptomatic?
Okay, sure. First of all, you cannot get COVID from this vaccine.
Okay.
There's no part of the COVID virus in the vaccine. It's merely a copy of the RNA. So, yes, you cannot get COVID. You're not contagious. You're not going to infect anyone. If you do get a fever, it's going to be because your body is recognizing those proteins and starting to do the immune response. So your body's having an immune response, and so the fever is kind of a good thing. The sore arm, the maybe body aches, that kind of stuff. That means your body's noticed it and it's making those antibodies to protect you from it. Yeah.
What all symptoms are there afterwards if you do have, a symptom after you get the shot?
Sure. Side effects are low-grade fever, soreness at the site. So these go in your arm. It's the intramuscular injection. So soreness in your arm. You could be red. It could be slightly warm to the touch. There might be a little lump there. You could feel kind of what we call myalgia, which is kind of a fancy term for just kind of achy and feeling kind of crummy. Those are the main things.
How often does anybody even really get symptoms? I mean, is there a chance where you're going to get a shot and you're not going to get any at all of a side effect?
I would have to look at the EUA to get the actual percentages for you, which I'm happy to do in just a second. But most of the side effects, and that's what we call these, the symptoms you're having after an injection or side effects, happen after the second dose.
Okay.
So you're more likely to this time just feel pretty good. What I'm seeing online from some of our local partners who have already had the vaccine is soreness, sore arm,
Okay.
low grade headache, maybe. But after the second dose, the incidence of those side effects went up.
Okay.
Yeah. And I believe, just off a recall, I think it was like 30% of the population experienced side effects after the second dose, but I would want to double check that number.
Okay. Well, that still don't sound too bad.
Okay.
And then my next question, I guess, would be if I do experience symptoms, ibuprofen's totally fine to take and all that, all the things you would normally. Cool.
Ibuprofen, Tylenol, to do cold compress if your arms were bothering you. Diet of frozen peas works great.
Okay.
Any other questions?
No, that's all. I feel ready.
Okay, great.
So if we're, hanging out with other people, are they protected at all if they're not vaccinated, or are we still a carrier if we come into contact with other people?
So that was definitely a question that we asked at the last one. So what I found out is after second dose, 2 weeks after that, then you're considered inoculated, like you're protected. Of course,
It's only like a 95%.
95%. So of course, there's still a chance. But yeah, no, I feel like that's after the second dose. So after this first dose, still definitely keep doing what you've been doing. And then after the second dose, and 28 days, which is January 20th, then 2 weeks after that, then you should be, I would say good to go, but you should be feeling a lot safer about getting sick.
Is there any superhuman strength or X-ray?
Not that we've known of yet, but as soon as we find out, I'll let you know. You told us if it happens.